composition and metabolic function in women with lipedema. My disclosure is that I have spoken in the past for Tactile Medical. The study team involved myself, who did the diagnosis and staging of lipedema, and a team of researchers headed by Dr. Samuel Klein at Washington University's School of Medicine. So the scope of the study is a comprehensive whole body, organ system, cellular, metabolic, and immune system characterization of people with lipedema. And compare this to these lipedema population with the classical obesity population. The goal to determine the effect of and therapeutic potential of diet-induced weight loss in this patient population. So women with lipedema underwent baseline testing of body composition, insulin sensitivity, adipose tissue biology, and immune function, and also vascular reactivity. And then they were followed for 4 to 6 months after achieving an 8 to 10% weight loss. And then these baseline testing were repeated. So the body composition was performed with dual energy X-ray absorption, or DEXA, and MRI, and a euglycemic insulin, euglycemic clamp, and also we studied insulin levels, fasting lipid levels, glucose levels, etc. Adipose tissue biology was performed studying immune function, heavy water turnover of collagen and fat, tissue oxygenation, and gene expression. So each of the individual participants met with individually with the dietitian and calculated their caloric needs, and a 25% caloric reduction was calculated, and all the meals and snacks were provided by the Washington University Metabolic Kitchen. The dietitian accommodated the meal plans according to gluten, dairy, nut, or egg sensitivities. The participants met weekly with the dietitian and picked up their food, and then came back the next week for weigh-in and further testing. The underlying characteristics of the lipedema subjects were measured, and we were matched BMI and age with the classical obese population, and you can see that the baseline glucose and lipid profiles were lower in the lipedema subjects. This is a plot of the weight loss in the subjects. And then going over here, this is the results. And I have to caution, these are preliminary. We are still enrolling in this study. The data is we're still collecting data. In fact, we're still interested in participants. We're going to probably be enrolling for another year. And this is, so these are not the final results. So we can see here in this study that that lipedema patients did lose fat with weight loss, and that and I'm looking for my pointer, and if I can, that was not good. Well, on the bar, the second bar on the left, you can see that there's that the lipedema patients started with a higher percentage of body fat, and so far this has not been significantly, that percentage has not been significantly changed. The contribution in fat, so down at the bottom on the left is the contribution of change in fat mass to total fat mass appears to be less, but again, not statistically significant. And then now over on the right here in the middle, the percentage of leg fat is not significantly affected by weight loss. But as you can see, they lost a similar percent of leg fat with weight loss. Okay, so look, by MRI, they did have a reduction in thigh volume and thigh fat, and that's what this shows. But despite having a greater percentage of leg fat on enrollment, the contribution of leg fat was not greater. Really, this confirms in a very sophisticated way what we have known about fat percentages and fat mass loss with weight loss. We also studied their glucose tolerance and compared them to matched classically obese controls, and they had a lower. The lipedema subjects had lower fasting and 2-hour glucose, and it also both improved with weight loss. This is some results of the insulin sensitivity and using the euglycemic clamp. And so in the middle, the lipedema subjects. At the bottom of the middle, you see the lipedema subjects before and after weight loss, and this is compared on the far left. There's the obese cross section, obese and normal. So these are the first in the far lower left is the metabolically normal weight individuals, and then in this center are metabolically abnormal, metabolically normal obese, and at the far on the right, the bottom of that graph, bottom right of that graph is the metabolically abnormal obese. So the lipedema group are close to the normal weight, normal metabolic controls, and their insulin sensitivity does improve with weight loss. And then on the bottom right is this is compared to the obese controls. So this is their the results of the intrahepatic triglycerides. And you can see that the pre-weight loss, the lipedema patients have lower intrahepatic triglycerides, and there's a little change with weight loss. Okay. Can someone help me? Okay. Can you just get to the conclusion slide? Nope. Back one. These are preliminary conclusions. So compared to age and BMI matched individuals, lipedema patients have a higher percentage of body fat and a higher percentage of leg fat, and are more insulin sensitive. This is basically, to this audience, kind of a no-duh. With 10% weight loss, the lipedema patients showed less change in percent body fat and continued to have a greater percentage of leg fat. And that's compared to obese controls. And lipedema patients are insulin sensitive and close to normal weight, metabolically normal individuals, and show less metabolic changes. Thank you very much.